Defense for exercise prescription. So for components of exercise training sessions, there are three components, which is warm up, conditioning, and cool down. So warm up, it is the preparation of the body physically and mentally for the conditioning. It contains a minimum of 5 to 10 minutes of low to moderate intensity for cardiovascular and for muscular endurance activities rather. It is also increases body temperature and lessen chances of injury occurrences while exercising. So, what is cardiovascular conditioning? Cardiovascular conditioning improves circulation and strengthens the heart, lungs, and blood vessels. It binds endurance and strength for the heart muscle, whether a person is well or recovering from a disease injury. So, for my client, because she is an asthmatic, her type of exercise for cardiovascular are swimming, walking, and sports with short bursts of activities. Why swimming? Because it is one of the best exercises for asthma because it builds up the muscles you use for breathing. It also exposes the lungs to lots of warm, moist air, which is less likely to trigger symptoms. For walking, asthma patients should still get regular exercise, and with the right approach, physical activity can benefit your asthma symptoms. Exercise helps by increasing lung capacity and reducing inflammation, which improves your overall lung health. For sports with short bursts of activity, in general, the best exercises for asthma involve brief bursts of exertion. Gentle, low-intensity activities are also ideal. These exercises don't overwork your lungs, so they're less likely to cause asthma. And what is muscular strengthening conditioning? It is a strength exercise in any activity that makes your heart muscles work harder than usual. This increases the muscle's strength, size, power, and endurance. So again, the type of muscular strengthening condition for her are hiking, recreational, biking, and short distance track and field. Why hiking? Because asthma patients should still get regular exercise, and with the right approach, physical activity can benefit your asthma symptoms. Exercise helps by increasing lung capacity and reduce inflammation, which improves your overall lung health. So, recreational biking. Try biking at leisurely pace. This is another gentle activity that doesn't involve constant exertion, and you can do also indoor cycling on a stationary bike. For short distance track and field, if you'd like to run, optimal for short distance running activities such as sprints. Long distance running on a track or outside may not be recommended in people with more uncontrolled asthma due to the ongoing effort required. So, the safety precautions for asthmatic patients when exercising are: use an inhaler before exercise. This will relax your airways and makes you easier to breathe during physical activity. Second is take medication for long-term control. This include overall drugs or additional inhalers that decreases airway inflammation if a pre-exercise inhaler doesn't manage your symptoms. Third, wear a mask or scarf to cover your nose and mouth when it's cold outside because the dryness of cool air can tighten your airways. Fourth will be limit your exposure to pollen and pollution. If you're allergic to pollen, exercise inside when pollen levels are high. Stay in areas with minimal air pollution. So fifth, avoid sports with continuous activity such as basketball, soccer, and long-distance running can be hard on the lungs if your asthma is poorly controlled. Avoid sports that are done in the cold, like cross country. skiing, and hockey. And most importantly, take a break as necessary. That's all. Thank you.